Thank you for joining the Pre-Operative Optimization of Hemoglobin in Gynecology series. You're reviewing the last module in the series. This is Module 4, Ordering Intravenous Iron Using Private Infusion Clinics in Ontario. For details about how to dose IV iron, reimbursement pathways for the drug itself, or ordering intravenous iron at the Ottawa Hospital using EPIC therapy sets, please view the other modules. Private infusion clinics are commercially run clinics in Ontario that provide infusions to patients outside of the hospital setting. Infusions are typically biologic therapies for patients with a variety of autoimmune conditions. However, these clinics are staffed to accommodate patients that require intravenous iron, and their nurses are trained in the management of giving this particular product. IV iron drug costs are covered in a separate module. However, the infusion clinics do charge additional fees to assist in covering nursing costs and the costs of administering iron products. These fees range from $75 to $175 per infusion. Any licensed physician or nurse practitioner in Ontario can access these clinics. They do require the physician to complete a required referral form and fax in a prescription for IV iron to the patient's pharmacy. The patient, hence, will be responsible for covering the cost of the drug and the infusion administration fee. In the Ottawa area, there's a number of private infusion clinics, including the Bayshore Clinic, Coverdale, Innomar, Inviva Clinics, NKS, or Specialty Health Clinics. The addresses, locations, telephone numbers, and emails for these particular clinics are listed on this slide. Please feel free to note these down and refer patients to the clinic that's closest to you. This is a typical intake or referral form for a private infusion clinic. The referral form typically would like to know the type of iron product you're giving. In this case, it's monoferric or ferric maltose, formerly known as iron isomaltoside. The dose is typically going to be 1,000 milligrams. As well, if the patient has a plan that utilizes the LU code 610, please note that down and check off as well if the patient has a private plan. There is a simplified nomogram included in most of these referral forms that can indicate how much IV iron to prescribe. Once the form is signed, it is faxed into the referring clinic, and then a prescription for the IV iron will be sent in. This concludes the brief module on how to prescribe IV iron using a private infusion clinic in Ontario. Thank you for your time, and I hope you enjoy the other modules in the series.